All right, I'll go ahead and get started. Hello, everyone. Welcome to Let's Talk COVID. This is the university's monthly or approximately monthly opportunity for our senior leaders to talk to our community about all matters related to COVID-19 on our campuses and in the DMV. My name is Alex Bako. I am the Director of Risk Management at UDC, and I see that we have some other leaders from our university with us. We have Dr. Guillory, Chief of Staff. We have Vice President of Human Resources, Deb Sullivan, Tiffany Cooper. I believe we also have Vice President of Facilities and Real Estate Management, Dusan here. So let's go ahead and get started. We have a few things that we want to talk about with you, some developments since our last meeting, since our last town hall. The first is the review of the institutional statistics related to COVID. There have been some surprising, or maybe not so surprising, things happening on campus related to positive cases. Not to be alarming, but a couple of weeks ago, many of you may have heard that there were some students who tested positive for COVID-19. If you can get us to the next slide, please. I hope you can see that. There were 2 weeks ago, during the week of November 5th, there were 5 cases of positive COVID on campus. 3 of the positive cases were student athletes, and 2 positive cases were students that were not athletes that were in the same classroom. And so that was something that we hadn't seen throughout the semester. As you can see from the graph, we had just been having one individual positive cases here and there, not too much going on throughout the entire semester. And then 1 week we had 5 positive cases all at once. I will tell you that each person that had tested positive was fully vaccinated. And so they tested positive for COVID, even though they were vaccinated. And those cases were reported to the Department of Health, DC Health. Contact tracers conducted and concluded their contact tracing investigation. And they had some recommendations. For the most part, the recommendations were to isolate the individuals who are positive and on campus in our resident dormitories and prevent them from being on campus during their isolation period. They retested, and at this point, I believe that all 5 of those positive cases involving students have been cleared to return to campus. And since then, there have been no additional positive cases reported. And so that's a bit of a glitch in what we had been experiencing through the semester. Again, it's not anything that we're alarmed about, but it was something that we were concerned about. And I think later on we're going to talk about testing protocols on campus and some new opportunities that we've brought on campus. And so we'll talk a little bit more about that in this town hall and give you a chance to ask some questions if you have any. However, as you can see from the graph, we still have only had 1 positive COVID-19 case involving either a staff or faculty member. And with the early cases of the early positive cases of a few students and the 5 that we had a couple of weeks ago, that gives us a total of 8 students who have tested positive for COVID-19. That's still a pretty darn low rate considering the number of students and staff and faculty we have. I still believe we're doing a very, very good job of complying with the mask requirements. And as you know, we've been enforcing and reiterating the importance of being fully vaccinated on campus. And so I think our protective measures are still doing a very, very good job of keeping the virus off campus. And so If you have questions and would like more details about that isolated event in which we had the 5 cases, please bring them up. We can talk a little bit more about the contact tracing investigation, some of the recommendations, and other things related to that. But um, with that said, I'm just going to go ahead and move on to the next topic. Um, Mayor Bowser on Monday announced that there will be some um, a lifting of restrictions related to COVID-19 in the district, and that primarily has to do with the mask requirement in businesses and in places of public and restaurants. Starting next Monday, it will be no longer required to wear um, face masks in certain places in business and certain public places. I believe this is part of what the district is doing to, I guess, to phase out the whole concept of reopen DC. I mean, DC is for the most part reopened, and so uh, the health department went on to um, talk a little bit about how the approach to reporting statistics related to COVID-19 from this point on will be more treating the pandemic as more or less an endemic um, uh, illness in our community. And so it's something that I think we're getting used to the fact that there's always going to be low levels of transmission, community transmission, very much like the flu, influenza. Is we're not seeing so much the high levels of transmission to the extent where we're going to treat this like a pandemic moving forward. And so part of that was easing the restrictions on the mask mandate. The mask requirement at UDC will still remain in place. In fact, um, the exceptions to the mayor's loosening of restrictions do not apply to, as you can see, public transport on buses and trains. You still have to wear a mask in train station, in airports, in rideshare vehicles, public schools, shelters, dorms, um, basic places where you're going to have frequent interaction between employees and the public, such in DC government agencies like DMV, um, and uh, uh, and other places where they have services offered to the public. You will still need to wear a face mask in those types of environments. But in general, when you go shopping, when you go dining, um, you're not going to be required to wear a mask. And so, again, I want to reiterate that the mask mandate will remain in place at UDC and all of our facilities and all of our campuses. And and my the feedback I've received from the university community is that every university in the DMV that I've spoken with in the last few days has said that they're going to retain the mask requirement on their campuses. And so it isn't as if um, the university communities were part of a group of people that were dying to dying to take their masks off and interact. I mean, I don't think that's the case. But I do know that for some purposes, there's a benefit to our businesses to perhaps not have that mask requirement in place. Perhaps that's the genesis for the mayor's um, the mayor's lifting. Um, but you're still seeing positive cases in the DMV. You're still seeing what we call moderate community transmission. Um, and so, again, I would encourage everyone to continue doing what you're doing if you're protecting yourself out when you're in public and you're around sensitive individuals, if you're around people of certain age groups or particularly vulnerable communities, people around children, people that may be ill. Please, as the holidays approach, please be mindful. Please continue to wear your masks and just be aware that we're not out of this COVID-19 pandemic yet. We're going into a holiday period where we're all getting together to visit with our families and our friends, and we're going places that we haven't been perhaps for a time period. And so, with that said, don't let your guard down just yet, right? Please be vigilant and protect your school, protect your families and those around you. All right. With that said, let's move on to the next slide. I believe we're going to have another one of our panelists speak to issues involving students and faculty.
Yes, good afternoon, everyone. Just an update as it pertains to spring 22 registration. So registration opened for spring 2022 on November 8th. And any student with an active COVID hold will be prohibited from registering for spring 2022. That is unlike how the hold was processed for the fall term, where the hold was placed just for tracking purposes and did not prohibit registration. However, for spring 2022, the hold, if you see it on your account, it will prohibit you from registering for spring. All continuing students must upload proof of vaccination by December 20th, and any new and readmit students must upload by January 4th, 2022. Review of the uploaded documents and the removal of the vaccination hold will take place up to 5 business days. So as the hold will not be lifted immediately after uploading your documents. You must allow at least 5 business days for the record to be reviewed and the hold to be lifted. The deadline for submitting an exemption request, that is for religious or medical, you would need to submit that by December 1st. And review of those exemptions takes up to 10 business days, which is why you'll see the different deadline date. And that is to allow students time to submit their documents and have it reviewed in time to have your hold lifted. And just also note that if there are any submissions that are incomplete, or if additional information is needed, that may extend the deadline for lifting the hold. And for further details on how to submit your or upload your vaccination proof or exemption documents, you can find that information on the UDC RISE website. Thank you.
All right, thank you. I think next we have Vice President Deb Sullivan. Hi, Deb.
Hi, good afternoon, everyone, and happy early Thanksgiving. It's glad to see so many people joined us today. I'd like to quickly give some updates around employees and our return when we leave for the holidays and return in the spring. So right now we are at 93%. So we've had an uptick in the number of employees who are fully vaccinated across all of our campuses. Currently, we have about 14 individuals who are granted medical or religious exemptions. I would like to remind everyone that any employee who was granted a waiver to domicile outside of the DMV, that ends on December 31st, 2021. So we expect all of our employees to be in the DMV starting January as we return after the holidays. The mandatory vaccination program and the policy will continue through spring for the spring semester, as Mr. Bako and others have stated. And I'd like to say that we've worked very closely with our SDS colleagues, and we've aligned our timelines for submissions for exemptions. And so the timelines are going to basically be the same. For any employee who is requesting a medical or a religious exemption for next semester, that must be submitted to the Office of Human Resources for the religious exemption by December 1st, and a medical exemption submission must be submitted to the Student Health Services by December 1st as well. So part of that is some people say, well, why would employees be submitting exemptions now? So we've had some employees who initially requested and were granted a medical exemption. They since are now requesting maybe a religious exemption. We want the time to review those exemptions requests thoroughly so that you are all ready to go at the beginning of January when the new semester begins. The other item I want to bring to everyone's attention is all employees. We invite you to go back and review the alternate work program that includes the policy that includes telework. We're asking all employees who are going to be teleworking or have alternate work schedules to update their agreements and have those submitted by December 15th. So start working with your managers. And as you're kind of going through your performance reviews for the end of this past year, you can go ahead and start talking about your telework opportunities for the spring semester. I'd like to remind everyone, if you have questions about leave related to COVID or any kind of long-term leave or just UDC leave programs, feel free to reach out to our Office of Employee and Labor Relations. Ms. Trina Bruce is our manager there, and she's also our leave coordinator. So I really just want to encourage everyone to have a safe Thanksgiving. As Mr. Bako and others have said, if you have questions related to anything human resource related, please feel free to reach out to our office by emailing udchr@udc.edu. Thanks.
Okay, so I guess this is me. Good afternoon, everyone. We are pleased to announce that we are going to start off offering a new option for testing. And given the recent cases that we had among the students a couple of weeks ago, we wanted to take extra precaution moving into the spring, as we do anticipate increasing our capacity in person and in classrooms, instructional capacity and whatnot. The law school is planning and preparing to fully return and resume instruction on site. And so we wanted to make sure we took every precaution possible to protect the UDC community. So we're going to begin a pilot of PCR testing next week, Monday, November 22nd. And this will be mandatory testing for select student and employee groups. These will be PCR tests. Next week, the testing will be on Monday and Tuesday in consideration of the Thanksgiving holiday. But following the holiday, the subsequent week, the testing will be on Tuesdays and Wednesdays, okay? Now, this initial testing period is just for select student and employee groups. And basically that includes student athletes, students who are in the residence halls, and then students and employees who have been granted vaccination waivers. Those individuals who have vaccination waivers are required to test on a weekly basis now. They go to health services for that. So we will start pivoting those individuals to get tested through this process, as well as now requiring weekly testing for these student groups, our student athletes and our students in the residence halls, because we've seen statistically that these are our highest risk groups. On campuses nationwide, it is determined that when you do have any risk of outbreaks, it is among these particular student groups. So they will pivot to weekly mandatory testing. What we will do is, starting December 6th, prior to that week, we will send out a communication giving everyone directions on if they would like to participate in the PCR testing, how they can do that. We figured we would make it available to everyone as we are thinking about perhaps traveling, getting together with family again over the holiday. It might be helpful for people to have a negative test result in hand. And so we will open the PCR testing up to the wider community. We will send a communication out to everyone about that and how you can do it. Again, it's a PCR test. Results are returned within 48 to 72 hours. Our understanding is that the results come within 24 hours after receipt at the lab. So if you imagine, we collect the samples here, the samples are sent to the lab overnight, and then within 24 hours from receipt at the laboratory, you would be receiving a email with your test results. These tests are oral swabs, and we will be encouraging self-sample collection, self-administered testing. Initially, in the first few weeks, these tests, the sample collection will be observed by a trained professional, but we want to ultimately educate everyone about effectively collecting their own samples. The oral swab is about the easiest one to do because it isn't a matter of like how far up you go. It really is just a matter of thoroughness. It's almost, think about brushing your gums and your tongue with a swab. So you have far less error for a bad collection. So just stay tuned. We're going to do this pilot with about 150, 200 folks with the mandatory testing in the next couple of weeks. But before we break for the winter holidays, we will open it up for other individuals who might be interested in being tested through the PCR testing. Also, we are discussing the feasibility of even more testing in the spring. We probably will not mandate that people get a negative test prior to coming to campus, but we will certainly strongly encourage people to take a test prior to returning to campus on the heels of the holidays, if you spent time with family, just to know we're all kind of starting the year off right and have been vaccinated and also now have a negative test in hand. But we will be talking more about that as the time draws near. We just wanted to remind people, we still do have the mask mandate in place, as Mr. Bako mentioned. These are again, once the instructions about how you can access PPE if you need it. So the LiveSafe app on your desktop or on a device. And I think that's it. We just want to remind everybody about the RISE website where you can find our dashboard, more information. This presentation will be posted there. The recording of this town hall will be there. And we will also include FAQs and more information about the PCR testing. And that's it. We want to remind everybody about our COVID confidential site, where if you do have a positive test result, you can send that test result to COVID confidential. Also, if you have any questions about COVID at UDC or any concerns about how we are managing COVID at the institution, you can send all of that at COVID confidential. So I'll stop sharing and we will respond to questions.
Thanks, Dr. Guillory. And I will just sort of reflecting on what we've just said, just add that the mask mandate on our campuses applies to everyone who might come on campus. So it's not just students, staff, and faculty. So I think that applies to our athletic events, for example. And so if we have other visitors and we have members of the public that come to our events on campus, that they still, for now, will be required to wear masks when they're with us.
So Alex, there are several questions in the chat.
All right, I'm trying to get to them. Let's see. Yeah, we have a few questions.
Yeah, about being fully vaccinated, whether it includes the booster at this point.
Let's see. I'm reading it now. So I'm kind of going to the first question that I see. So that if people have sent in information for the fall, do they have to resubmit information for the spring semester? I'm not certain exactly what they're referring to as when they're saying, will they have to resubmit information
So Alex, I will just say, if they're talking about submission of vaccination information, no, it's captured in the system. If they're referencing, if it's an employee and it's telework or alternate work, yes, you have to reaffirm your telework or alternate work plans for the spring semester. The plans you created were only for the fall.
Okay. I see something from Megan Kowalski where she asked, is a two-shot plan still considered fully vaccinated, or will boosters change things? Um, Mercy, I saw that you're online. Can you perhaps respond to that?
Yes, hello everybody. Good afternoon. Fully vaccination still means you have the 2 required doses of the vaccination. The booster is important for especially for people that have high risk people, elderly people. So there are some group of people that are really required to have that booster. Although it's open to everyone, but I don't think it's needed to be considered fully vaccinated. We will post the recommendation or guideline from CDC on the RISE website before the close of today, business today. So people can go there and really see what CDC is saying about the booster dose. Thank you.
Thanks. Thanks. And I do see a question about, let's clarify the testing that Dr. Guillory went over. Will it be for everyone, or will it be for students only? The testing right now will just be for the vulnerable groups that we identified. But as Dr. Guillory said, the testing will be opened up to everyone who wishes to be tested.
Right, and that will open up on December 6th, but you will have to do some pre-registering. There's an online portal that you have to sign up for, so you won't be able to just go to the test site. You'll have to kind of do a little pre-registration and whatnot. We need to get a sense of how many of these tests we need to have on hand. So probably starting the week we return from Thanksgiving break, we will send out information about people pre-registering to be a part of the PCR testing.
Ms. McNair asked a question, will we be required to return to the office 5 days a week, or we will remain in a partial telework mode?
So I can respond to that, Alex. Thank you, Ms. McNair, for your question. As we all know, in the policy states, telework is granted based on the operational needs of the unit. We are currently maintaining the same policy and posture for the spring semester. So right now, the maximum number of telework days is 2, but it is up to the manager of the unit. Okay.
Deb and Dr. Beckett, there's a question about where do people find forms for the medical exemptions?
Right. And so those are on the RISE website. They simply need to just click on that and we'll refresh it to make sure. But if you go to the RISE website and click on the vaccination policy, all forms are associated there. But I'm happy to send to Truett the forms if needed. We can have someone send it directly, but they are on the RISE website.
Thank you, VP Sullivan. That goes the same for students. All of the links will be there for everybody.
Thank you. There was a clarification request for the 6th of December. For December 6th, can we also bring a family member? I'm not certain what that is referring to. Can you
I'm talking
please?
about for the testing, the PCR testing.
Okay.
So what we'll do, well, I'll have to take this to the task force. I've been in instances where we did extend testing to friends and family, particularly in anticipation of holiday gatherings. So if we did do something like this, it may be on a limited time, maybe just for those 2 weeks prior to the winter break. If we did do this, we would need to create a special category of, kind of non-UDC affiliates, but this would be something that would have to be vetted by the task force. And we can let people know about that in our next update through our COVID newsletter.
There's a question from Michelle Halstock. What is the policy for bringing high school students onto campus for experiential learning activities? Causes has received several requests for visits to the urban food hubs and to the architectural studios. I'll go ahead and take a stab at this. Someone else can clarify or give additional information, but at this point, in the semester and through this semester, we have not had an open policy of bringing students onto campus or high school students on campus. We were promoting virtual tours of our facilities where they were available. At some point, again, as Dr. Guillory just said, at some point the COVID task force will be making recommendations to cabinet to perhaps lessen some of those restrictions. But as far as I understand, they haven't been done yet. Can we go over the vaccination rates for the students? That was presented, I believe, on our COVID dashboard page. And I don't have that information at my fingertips, but would somebody who knows that answer talk about the vaccination rates for students?
Dr. Jim, can you give the data for the student vaccination rate?
According to the dashboard that's on the RISE website, I think it
Mhm.
shows like a 97 or 98% vaccination rate for the students who are on campus. Okay, we have to keep in mind that there is a large percentage of students who are online, who are strictly online. And again, the push is to bring more classes on campus and in person. So we are looking to, I think Ms. Cooper can again speak to this, how many more additional students have been uploading that vaccination documentation. But clearly, given the vaccine mandate, a considerable proportion of the students who are on campus are indeed vaccinated. Dr. Beckett or Ms. Cooper, would you like to say more about that? I just went back to the slide and looked at the number.
So thank you, Dr. Guillory. You're correct. It's 97% of students who are on campus. In our most recent task force meeting, Dr. Ijumo did confirm for us that we had an additional 165 students that uploaded. And Ms. Cooper did as well, their vaccinations. So since November the 1st. So we're watching that very, very carefully and monitoring it just as much as we're monitoring the entire community to make sure. We do anticipate that we will receive higher numbers due to the spring 2022 registration mandate.
Jay, can you please elevate General Counsel Russell to a panelist? She wanted to address the question of student groups coming to campus.
Okay. Okay.
Thanks.
And we'll immediately come back to that. But how about a question I see here that students have stated that they're not able to enter their records, the immunization and COVID-19 records into the health portal. Who should they contact for that?
Students should contact health services. I'll just put general information in the chat.
Hi, Avis Russell, General Counsel. I just wanted to clarify that for some of the programs, ongoing programs that have been held virtually with UDC programs where the students are from outside of the university, we have put in place some of those programs for in-person participation. However, the students are required to be vaccinated, and they are required, they or their parents are required to sign a waiver to participate in those programs. So it's done on a program by program basis as approved by the chief academic officer. Thank you.
Thank you. I believe, unless I've overlooked something, that covers the questions that have been submitted in our chat box thus far. If you have any questions about the information covered today, go ahead, please.
One of the attendees has their hand up. I think they want to speak.
Okay.
I just requested them to unmute, so hopefully they'll come on. Nicholas?
Yes. So that was me that had a question about the vaccination rates of the students. And I guess the reason I asked that is because I think, I'm under the assumption that maybe a lot of our students are have a bit of hesitancy to get vaccinated. So I guess with that being said, I guess I find it kind of contradictory that right now you mentioned that the mayor is allowing businesses to operate, allowing people to come into business without the mask in order to, I guess, increase profit or whatever the case may be. I think that's what you said earlier. But at the same time, we're like excluding a group of students from registering from classes because they don't have the vaccination. That seems a bit contradictory.
Well, let me be clear. I did not say to increase profit. I just said that for whatever the mayor's reasons, she has determined in consultation with her advisors that under certain circumstances, it's appropriate to lessen the restrictions in the district. She did keep in place the mask requirements in certain environments and with certain populations.
Correct. No, you didn't say to increase profit, but you said to benefit business. So that's the way I interpreted it. But it still seems a little, I guess, contradictory. On one hand, you're allowing businesses to benefit, but on the other hand, you're saying to these group of students, we're not going to allow you to progress.
Well, just keep in mind as well that the lifted mask mandate does not apply to schools. So, I mean, there is still the understanding that these are the types of environments where we need these additional precautions, including masks and vaccines, to protect those communities. So even with the lifted mandate, for whatever reason, schools are not included in that, and UDC is not included in that.
No, I understand that, and I guess I'm not advocating that the university allows students to come, I guess, on the campus without masks and just to disregard all safety. But I think that if you take into consideration that the things that our students are dealing with, being that right now they're not only I guess competing against other students, but in the future they'll be competing against AI and technology and things of that nature. I don't think that this is the time that I guess we should do anything that impedes the progress of our students, and I think that we should take every opportunity, or exhaust all the options to make sure that students continue to learn.
Let me jump in
Whether-
too,
whether-
Dr. Guillory. This is William Latham, Chief Student Development Officer. So Nicholas, we appreciate your question, man. First of all, we definitely hear your concern. Have obviously gone out to really support students in a couple different ways. Obviously through the RISE scholarships to be able to return and take care of prior balances from last year. That's the RISE initiative, as you see on the RISE website, in terms of tuition and scholarship assistance. And then certainly the CARES money has been distributed to students, $6 million last year, $2 million this semester, and $1 million we spent for non-Title IV eligible students in terms of DACA and Dreamers last year. So from our standpoint, we certainly want to make sure all students are supported across the board to be able to continue their education at UDC. That's our first goal, right? Is completion of the degree. And that's what we're responsible for here as an institution. So we certainly believe in that, and certainly that's our mission. So anything else that we can do to support students even further, we took care of the books for this semester, obviously for all students across the board through Follett All Access Program. The university covered that. They're going to cover it again. We're going to cover it again for the spring semester. So we really try to lean in, Nicholas, to make sure that we can do all we can. But the safety protocol around the students coming back is what we want to see, and why we have that particular vaccination mandate for the spring in place, because we know students are going to return to campus in greater numbers in the spring, and the summer, and the fall. And we want everybody to be safe and healthy. We want to create a safe and healthy environment for all students to return and participate in their experience of graduation and completion at UDC. So that's the underlying premise behind that. We certainly don't want anyone to, not persist because of that. And that's why we have these access points for students to have contact with us during these times, to make sure if they have certain needs, they can reach out to us directly and find out what those supports are. And then from a financial aid standpoint, counseling, health services standpoint, and whatever else they may have needs around specifically. So reach out to us if you have students that that need those types of supports directly to us, and we can make sure we get that type of need taken care of as much as we can from the university's perspective. But that's the premise around both of those particular supports for our students going forward for the spring semester.
Yeah, most definitely. Everything that you mentioned should be commended, because it is good. But I guess my question is, if a student is not vaccinated and they choose not to get vaccinated, will they be able to attend in the spring? Like, will online classes be offered to them? Will that option be available to them?
They're going to have to get vaccinated regardless, whether they're online or in person for the spring semester.
And so, I mean, like I said, everything that you mentioned is good, but the way that I see it, it's still like right now, it still seems as if those students are being excluded, and it seems to be a contradiction, because, like I said, you're saying, okay, it's a matter of I guess safety concern, but then you're not you personally, but the mayor is saying, okay, no matter your vaccination status, you can come into the business with or without a mask. So that's just a contradiction to me. But I guess there's no need to go back and forth, though.
Thank you.
And thank you for the question and those comments. We have another question from Sandra Shanstrong, who said, who asked, would students who withdrew from the university during the fall semester have to resubmit their vaccination documentation as readmitted students for the spring 2022 semester? Dr. Beckett, perhaps, could you answer that question?
This is Tiffany Cooper. I can answer the question. So if a student withdrew and they submitted their documents in the fall when they were at the university, they will not need to resubmit those documents. Their initial submission is tracked in the system. So when they go to reapply, we will already see that they have submitted their documents, so they are good to go. They will not need to resubmit. If for some reason in the admissions process that they see a new COVID hold, they would just simply follow up with the admissions office to confirm that hold. And admissions, if they see that the original hold was lifted, they should be able to remove it.
Thank you, Ms. Cooper. A question was submitted, where do I find the interim telework agreement form for 2022? Which I guess means, is there a new interim telework agreement and where is it?
So we're gonna update all of those forms, but they are available on the RISE website. And I put the link in the chat.
Thank you. There's a lot of good information in the chat right now. I'm not certain that I see any additional questions at this point, but go ahead. We still have about 10 minutes for Q&A and discussion.
While we're waiting to see if we have any additional questions, I just want to remind everyone that we did change the date for the year-end COVID town hall. We pushed it up a week just to try to capture more employees and students before everyone kind of disbands for the holiday break. So the next COVID town hall meeting will be on December 9th. That will be right after we launch the open opportunity for people to participate in the PCR testing. And hopefully by then we'll send out some information about if we will have the capacity to test friends and family during that period. I don't think that this would be something we would do on an ongoing basis, but I will check with the COVID task force to see if we can at least offer it in a limited capacity in anticipation of the winter holidays.
We do have another question.
Yeah, you have a question about notifying professors about students testing positive?
Yes. Would you like to answer that, Dr. Guillory?
Well, you can answer it.
Okay.
Sure.
Sure, I'll go ahead. The protocol is that we hope that students who test positive use our anonymous notification email address, covidconfidential@udc.edu, to notify the university and submit their positive test results. That initiates the process. Once that occurs, a smaller group of individuals at the university will ensure that the professors in the classes that the student is attending are notified directly that the student is tested positive. There is no requirement for the student themselves to notify their professors. Will testing be at the main campus, at the Van Ness campus only?
So for this pilot period right now, we are only doing it at Van Ness, and we probably would be doing it exclusively on the main campus through the end of this semester. In the spring, we will consider the possibility of making testing available at the other sites. It really is just a staffing and capacity question. Like I mentioned as well, we are trying to pivot to a more self-administered testing process. The district's testing is self-administered, and we what the testing process that we are taking on now is self-administered as well, which would make testing at remote sites more feasible. So I would anticipate that in the spring we would have options for remote testing, which would basically mean that you would have a place where you could pick up a test kit, collect your own sample, drop that kit off by a certain time on a certain day. It would be delivered to the lab and you would get your results. So I'm hoping that by the spring we will have an opportunity for that.
Thank you. There is an additional question related to the community college. Since the community college is moving to the Bertie Backus campus, can we speak to the ventilation system and facilities at Bertie Bacchus. So I don't know if we would have to move Vice President Dusson to a panelist to be able to respond to that.
He's removed.
Thank you, everyone, and thank you for the question. We are addressing all the systems in all the buildings, specifically at Bertie Bacchus. We're making sure that the air conditioning system, along with every other component, is ready for all the occupants when they move. There is a communication being put together, and more information will be available on these and other topics related to the move. I understand that even in the last town hall meeting, there was information being provided along the lines of a communication being put together at the president level that it should come relatively soon. I don't have the dates for that, but that's where the communication is going to come from in terms of the move and any other details. We're also planning some open house, not activities, but an open house at Bertie Bacchus. More information on that will be coming, so people can go and see the place themselves. So I hope that answers the question. Thank you very much.
Thank you, Vice President Dusson. A question from one of our faculty members. I'm a professor at one of the classes where students tested positive. My dean eventually notified me, but how do I keep attendance?
I can answer that one. So to Professor Cohen, a member of our team will reach out to you directly to make sure that we make the proper arrangements for students who are testing positive, to make sure that they're still getting their coursework done while they're in the quarantine phase. And so a member of our team will work with you directly to make sure that you're still getting the work from the student, which allows you to be able to keep attendance. And then we can have a more offline conversation about that process.
Thank you, Dr. Baggett. There was a comment from Ms. Kowalski, and it's actually a great comment that the district Department of Health and the district as a whole has opened up a program called Test Yourself DC, and Ms. Kowalski put the link into the chat box. Coronavirus.dc.gov, test yourself, in which anyone can pick up a PCR COVID test kit, and they can get themselves tested. It's a self-administered test. You have to fill out the paperwork, and you have to return the completed test specimen in a sealed container at the site where you picked up the kit, and you will receive a test result within 24 hours of submitting that test sample. There are, I believe, 13 locations around the district. Some, but not all of them, are at public libraries. But it's called Test Yourself DC. Go to the chat box and check out the link if you're interested. But it's a way for anyone who's interested in getting themselves tested to get a PCR test at any time. So please make use of that if you're interested. An additional question: are we still adhering to social distancing? And if so, is it 3 feet or 6 feet? I'll go ahead and say that when the university implemented the mask mandate and the vaccine requirement, it became less critical to maintain the social distancing. And so there are no social distancing requirements on campus and classrooms right now. However, we do encourage people, particularly if you don't know someone or if you're in situations where, for whatever reason, you're unsure about someone's vaccination status, or if you happen to find yourself in circumstances where somebody's not wearing a mask, to please maintain your own distance from them as much as possible. But there are no 3-foot or 6-foot distancing requirements on campus right now. We still have a couple of minutes. And I don't see any additional questions. Well, we may get a question or two, but I do want to wish everyone a happy Thanksgiving holiday and break. Again, please be aware of the testing that is going to become available on campus beginning next week for the select groups, and then after that for everyone else on campus. Please reach out to health services if you have questions about those services. I will open it up to anyone else on the panel that might wish to have some parting comments. All right, then. Well, seeing that there are no additional questions. Wait. One came in at the very last minute. Mr. Pearsall, the COVID requirements seem to be very fluid. Will you make sure Bertie Backus will be able to adjust to these changes? We will. We will make sure that our facilities, wherever they are, and whatever changes occur with employees and students, we will make sure that our facilities are able to adjust to whatever the requirements there are to ensure that we're protecting everyone on our campuses. Absolutely. With that said, thank you everyone for a very, very informative and productive town hall. Again, have a happy Thanksgiving holiday. We will see you at the next town hall